ਇਸ ਸੈਗਮੈਂਟ ਦੇ ਵਿੱਚ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਨ ਜਾ ਰਹੇ ਹਾਂ ਅਲਬਰਟਾ ਦੀ ਟਾਪ ਡਾਕਟਰ ਡੀਨਾ ਹਿੰਸ਼ਾ ਦੇ ਨਾਲ ਜੋ ਮੇਰੇ ਨਾਲ ਲਾਈਨ ਤੇ ਨੇ। ਹੈਲੋ ਡਾਕਟਰ ਡੀਨਾ ਹਿੰਸ਼ਾ, ਵੈਲਕਮ ਟੂ ਮਾਈ ਸ਼ੋ।
Hello, thank you for having me.
So let us start with this question. How big of a risk is COVID-19 in Alberta right now?
Well, our numbers of both new cases of COVID 19 and the number of people who are in hospital with COVID 19 are higher than they've ever been before. So, COVID 19 is a risk in the province right now.
As the cases are increasing in Alberta, will there be mandatory restrictions in coming days?
One of the things that was a commitment that was made when relaunch started in May was that we would be looking very closely at the impact that COVID 19 had on our acute care system in the hospital numbers and our ICU rates for COVID 19. And those thresholds, so we set a certain number that we said we didn't want to go above a 5% daily increase over 2 weeks. And we didn't want to go above 50% of our ICU beds for COVID. And those numbers, thankfully, we haven't crossed yet, although we are getting closer. And so the question of whether or not we're going to put in place mandatory restrictions, if they're needed, because our acute care system is starting to be overwhelmed, they are certainly on the table. But right now, we're really encouraging Albertans to look at the guidance, to follow the measures that are in place in the places where they live, and to help us by getting those rates to come down before we need to use mandatory measures.
Dr. Hinshaw, if we are in the stores or in public place, we need to have 2 meters distance. But if the students are in class, then they don't have 2-meter distance. Why so?
There's a couple of reasons for that. One is that if you're in a store in a public place, you don't necessarily know the people that you're going to be coming into close contact with. And making sure that you stay that 2 meters apart at all times is one of the best ways in those settings that you can prevent transmission. In school settings, we do recommend that students stay 2 meters apart at all times, with the one exception is when students are sitting in their desks in a classroom and they're doing quiet work, they're not moving around, and they're not exerting themselves. They're not, for example, if they're in a sports class where they might be breathing heavily, there's a greater risk of transmission if they're sitting quietly in their desks doing their work. First of all, students are in a cohort, so they're with the same people all the time. And if someone is infectious, we can very quickly notify those who've been around them. And second, we do know that younger children in particular are not as likely to pass disease on to others as older kids or adults. So we have made these adjustments to our recommendations based on the fact that we know that kids benefit from being in school, and the way that we would be able to have that 2 meters of distance at all times in all classrooms, we would only be able to do that by alternating students in classrooms one day and then at home the other day. And we felt that if you're looking at all the possibilities, it's better to have the kids in class together in a consistent way, and that we have all the other measures in place. We're screening for symptoms. We have them masking at all times when they're not in that quiet classroom setting. And we're making sure, for example, that if there is someone who's infectious while in class, those who they're in contact with are immediately notified and kept home. So we have a lot of other controls in a classroom setting that aren't possible in settings like in a public place or a store.
I'm sure you must have modeling for second wave of COVID-19 in Alberta. Can you please tell me a little about that?
As you know, we did modeling at the beginning of the pandemic experience in Alberta, and that modeling was really done looking at the kinds of numbers we would see if the virus were to spread rapidly and without any interventions. And that modeling that was done in the spring is really still relevant now with that question of what would happen if we took away all of our controls? What would happen if we stopped following public health measures? What would happen if we had no restrictions on virus transmission? And what we would see is exactly what we had looked at in those models in the spring. So we don't need to do new models of that kind. What we have been looking at, and the models aren't done yet, but we've been working with our statistics team to look at what kinds of testing numbers might we expect in the fall if we would be looking at, for example, our influenza testing. And influenza often has similar symptoms to COVID, plus COVID testing So those are the kinds of predictive work we're doing. But again, we're still in the process of that and haven't completed that work.
Why are cases rising in province, especially in Edmonton?
It's interesting to see this increase that's happening across the country. And really, I think one of the main drivers is the weather's getting colder. People are spending more time inside. And we also know that over time, people around the world are getting more tired of COVID restrictions. And so it's harder to convince people to follow all of the public health measures in every aspect of their daily life. While Edmonton certainly has been a hotspot over the past while, we are seeing the numbers in Calgary start to come up. As you know, Calgary has moved into a watch category, meaning that it's now over 50 cases per 100,000 as a city. And so while I'm concerned about Edmonton, I'm concerned about the rest of the province as well. And I want to make sure people know wherever they are in the province, it's really important to continue following those public health measures.
Dr. Hinshaw, what is the difference in symptoms of the COVID 19 and the other normal flu? How bad the flu can be this winter?
You know, the symptoms are actually very similar. So the symptoms of COVID-19 are cough, fever. Sometimes they can be mild, like having a runny nose or a headache or feeling aches and pains. And those symptoms are almost exactly the same as what somebody experiences when they get influenza. It's not possible to tell those two apart just by how someone feels. You can only tell the difference by testing. We don't know yet how bad this influenza season will be. And the same measures that protect us from COVID, the making sure we stay home when we're sick, washing hands regularly, staying distanced from others, wearing masks, all of those things will help prevent influenza as well. But there's one additional thing we have for influenza that we don't have for COVID, which is the vaccine. And we're really encouraging people this year to get vaccinated against influenza, because the more people we can protect from the flu, the more we can protect our whole system from the severe impacts, both of COVID and the severe disease that influenza can be, especially for older people and the very young.
What are some of the myths about the COVID 19?
You know, I think there's starting to be a unfortunate misunderstanding of the information that's out there. And there are some people who are starting to believe that trying to achieve herd immunity through natural infection is the right way to go. That's a really dangerous misconception. And when we have a bunch of our population infected, if we allow this virus to spread through our population, even if it's only a population less than 60 years old, we would still see hundreds of deaths and thousands or tens of thousands of people in hospital if we were to get to, say, 50 or 60% of that younger population having COVID. So I think it's a really dangerous myth. Some people are believing that COVID isn't serious, that COVID is just a mild disease, and that we don't need to worry about it, when in fact, it is very serious for many people who get it. And even those who have a mild course of illness can suffer symptoms for months afterwards. So this is something that we need to take seriously, not only for ourselves, but for those around us as well.
What is the position in the hospitals for the patient related to COVID 19 in Alberta?
Right now, we do have several hospital outbreaks that are underway, which of course is impacting the ability of those hospitals to care for other patients with respect to having less staff. The staff who were exposed have to stay home for 2 weeks. So while overall our hospitals are able to manage the current numbers of COVID cases and have been able to continue providing other services, if we see a lot more cases in the community, that will automatically translate into more cases in hospital, and it could put the rest of our hospital services at risk, because we might have to stop doing other things like elective surgeries in order to care for COVID patients. So we're doing okay right now. The system is managing. We have capacity, but it's at a point where we could be in trouble if our cases continue to rise.
So, in the end, when will the COVID 19 pandemic be over?
That's a good question. And I think what we know right now is that COVID-19 won't go away on its own. There are a lot of different vaccines in development. And if we can get a safe and effective vaccine, that will be one of the best tools to be able to stop the pandemic from having an impact on our lives. There's also things like different treatments that are in development. Unfortunately, we don't yet have a cure for COVID-19, but there are different areas of research looking into that. And we also know that rapid testing can make a huge difference. And different technologies being able to accurately and quickly test for COVID could also help. None of that will make COVID go away, but what it can do is help us get back to a more normal life.
Thank you so much for joining my show, Dr. Hinshaw.
Thank you so much for the opportunity. I really appreciate it.
ਥੈਂਕ ਯੂ ਸੋ ਇਹ ਸਨ ਡਾਕਟਰ ਹਿੰਸ਼ਾ ਜੋ ਸਾਡੇ ਨਾਲ ਐਕਚੁਅਲੀ ਸੇ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਸੀ